Hi, I'm Dr. Stephan Smith with Advantage Family Chiropractic. What I'd like to talk today about is orthotics. People have all kinds of problems with their feet. I have problems with my own feet. I'm very flat-footed. One thing that I have done for myself, and I recommend this to my patients who can be helped by it, is orthotics, meaning the inserts that go into your shoes that help to balance your feet and give them support where they don't have enough support. Now, I know a lot of shoes that you buy have an arch support and some don't. People wear flip-flops all the time. People wear sandals all the time. People wear shoes that look nice but don't really give you any support. And these shoes all, they're not very good for your feet, let's put it that way. Even a good pair of shoes, whether they be an athletic shoe or even a shoe that's designed for walking, standing, that kind of thing, sometimes don't have the support that help balance your foot so that supports the rest of your body. You have to understand that your feet are your foundation. So if your feet aren't right, then your knees aren't right, your hips aren't right, consequently your pelvis isn't right, and that just runs right up what we call the kinematic chain, meaning it affects your spine and everything else. Orthotics help stabilize and balance your foot so that your foot is planted the right way. When your foot's planted the right way, your knees are oriented correctly, your hips are oriented correctly, your pelvis is more in balance, and as a result, then your spine is more in balance. There are 3 arches in your foot, not just one. Everyone thinks of the medial arch, or that inside arch, the one where you have fallen arches, or no arch if you're flat-footed like I am. But there's also a lateral arch, meaning the outside of your foot, there's supposed to be an arch, and then across the ball of your foot there's another arch called the transverse arch. All 3 of those arches need to be supported properly in order for your foot to function the way that it should. We scan for orthotics in our office. There's a company that we use called Foot Levelers that we really like. Those orthotics are built in a custom fashion based on a scan that we do of our patient's feet right in the office. It takes minutes. And those orthotics then are built, they slip into your shoe, they can come out and go in another shoe. They're really nice. But they help balance and support that foot so that people cease to have the knee problems, the hip problems, the low back problems that are associated with imbalances and unleveling of the feet. If you're having problems with your feet, if you're having problems with your low back, if the back of your knees, the back of your legs, your hips hurt all the time, then it could very well be that you need some balance in your feet. So talk to your local doctor about orthotics. If they don't have a way of scanning for orthotics, they can put you in touch with someone who can. Get that done. It's really a good way to help yourself out and help end a lot of low back problems. I'm Dr. Stephan Smith with Advantage Family Chiropractic, and stay on your feet.